We just want to give a really big welcome from World Vision South Africa. This is the first of many webinars that we are going to be running on issues that affect our nation and affect our entire continent. And we really just want to raise the issue of what we as individuals and the organizations we can do, that we work for, can actually do. And I'm always skeptical of us having conferences and webinars and the like, where it's just people who are involved with the issue talking about the same stuff that's been spoken about time and time again. So I've really challenged our four amazing speakers today to ensure that at the end of their call or the end of their talk, there's a call to action. So what do we actually want to do? So before we get into the detail, I just want to share with you who World Vision is. You may not know. World Vision is one of the world's largest NGOs. We operate in 100 different countries. We've got about 37,000 staff. We are a 70-year-old organization that started in Korea by a US serviceman during the Korea War, a gentleman called Bob Pierce, and he saw just vulnerable children and orphans on the streets of Korea. And he started this organization where he got funding from US citizens to look after the orphans there. But he had the vision to call it World Vision. And from that simple start 70 years ago, it's grown into this significant organization that is helping vulnerable children. So this is key. We focused on vulnerable children, and we like to say the most vulnerable. So we will work in the most vulnerable communities right around the world. I mean, at the moment, we're in Syria and Afghanistan and the DRC and Sudan and right here in our own country. In South Africa, we have been present for 54 years. We've been fighting against inequality for 54 years. We have worked previously in all of our provinces, but currently we are working in the Eastern Cape, Limpopo, KwaZulu-Natal, and in the Free State. And that's our desire to really ensure that we go to the most vulnerable parts of the country. So at the moment, we don't have any programming that is close to cities. We are really far away in deep rural communities where the need is great, and often where the reach of social investment, corporate social investment, doesn't go because it's not close to cities. We've got a desire at the moment to be involved in three crucial areas. So the one is WASH, and that's why we have this conversation today. The other is around local economic development, but with a specific focus on women and youth empowerment. And then the third one where we want to focus is around education. And specifically at the moment, we're focusing on early childhood development. We think that that is a massively underinvested space and an opportunity for us to change the trajectory of so many lives in South Africa into the future. But every single one of those and the other areas where we operate all hinge around the most important part of life, which is access to clean drinking water. And I'm just going to pop up the slides that I had on earlier, because I just love the joy that's being expressed in these children's faces. It really brings a smile to my face, the delight of them just standing around what is a borehole and a hand pump, and just getting that opportunity to experience clean water, life-giving water, and access to something which so many of us have access to just by walking a few steps and turning on a tap. Just as it's a way of introduction, I'm going to put a quick poll up. And again, you should see it in the right-hand side of your screen. And it's just to get a simple understanding of how you see the current situation of access to water in our country. So on the right-hand side of your screen, if you can just click on where the appropriate answer for you is. So the first question is, how is your organization primarily involved in WASH? So is it through funding third parties? Is it advocacy within a local environment? Is it advocacy within a national environment? Is it hands-on community work? Is it all of the above? Or is your organization currently just exploring how to get involved? And if I have a look at the numbers coming up on that particular question, it looks like many of you, in fact, half of you, are exploring how your organization can get involved. And that's really wonderful. So you're going to meet people from 3 organizations, World Vision, UNICEF, and the EU. All would be happy to have your involvement in a variety of ways. As I see people adding their answers, so hands-on community work, so people really involved. It's good to see that a quarter of you are involved in everything. And although no one is specifically calling out advocacy, the 20% of you now who are saying that you're involved in all of the above means that you're very much involved in advocacy, local and national, which is really important if we want to get a change to policy and to local governments, local departments understanding the necessity to spend money in those areas. Super. And then we're going to go to the next question. So just a simple one. So does the home where you currently live have access to clean water on tap? So currently 100% of us are saying in my home now, my home has access to water. And I would think that many of you are calling from urban areas, which means that's most likely to be the case. So I think we can actually end that poll quite quickly. And this is the next one, which I think is really interesting. Does the community in which you were born or raised as a child have access to clean water on tap? So we all probably live in a place now, but where we were born, where we were raised, does that have access to clean water? Because this is so interesting. As we move into urban environments, we have it. But what about the places, the communities that we grew up in? And it's very interesting as I'm watching that poll move. So we've got about 2/3 who say yes, it did. But 1/3 of us on the call today are saying that there was no access to clean water on tap in your homes. And that's really telling. That means that 1/3 of us, now 40% of us, have that real experience of no water in our homes and having to go far away, walk, and access those water. And then just the last question is going to come up shortly. What is the starting point to solve ubiquitous access to clean water? So there's many things that we need to know, and all of us who are interested on this call know the many challenges. But if you had an option now to say, let's get going with one place where we can change access for all, so ubiquitous access, not just for us in urban areas, but for everyone in this beautiful nation of ours, where does it start? So we've got about 16% saying political will, about 10% now are saying improved advocacy at a local and national level, but by far the majority is saying awareness raising that drives action in citizens. So real spread out. And again, still lots of people saying political will is essential. Absolutely. Money. So for sure, money spent in the right areas. Improved advocacy at a local and national level, but still most people saying awareness raising that drives action. Okay, so let's we can actually stop that. And I think that's it's quite important. The issue that we face in our nation is complex. It is not easily solved. But if we don't take those first steps, if we don't do some of the things that we've just said in that poll, by advocacy that will drive political will, by actually opening our wallets of our organizations and us as individuals and giving money into this cause, without actually creating broad awareness as to how all of us can contribute, whether you're a small child, whether you a CEO of an organization, whatever it is, how do we all get involved? And awareness creating is absolutely crucial to that. So if I had to answer that poll around where do we start? For me, it's about how do we create awareness of the need, and then most importantly, awareness that people can have an impact regardless of where you are, whether it's through donations, advocacy with your organizations, just making sure that the people who might even work in your home have access to water when they go away to their homes, maybe in rural areas. So that's what today is. Today, my wish and World Vision's wish is this is an opportunity for us to create awareness. We would like to take what you hear today from our 4 esteemed speakers into your organizations and say, right, how do we now use this to spread the gospel of ensuring that we create fantastic access for all people to clean drinking water. And remember, and many of you already know this, it is not just about the fact that we need water to live. But if you don't have access to water in your home and you're a small child and you have to walk, which 6 kilometers to go and get water, which is the average distance rural people walk to collect water. As a young girl, you are exposed to the danger of violence against you. Not having water in your home means that sanitation and hygiene becomes difficult. It means challenges around menstrual health become challenging. So this is more than just water to drink. This is about the livelihood and and getting our nation to thrive. So we have 4 speakers today. The first one will be Dr. Emmanuel Opong. He is the Regional Director for WASH and Capability Building in World Vision Southern Africa, and he's responsible for 9 African countries and the WASH programming in those markets. After him, we are going to hear about what it means to work in the water field on the ground from Thulang, Lecheko. He is the project coordinator for World Vision's Ford Water Generation Project, based in the Nelson Mandela Bay Metro, so we'll get some nice practical on the ground insights from him. Then we have Janine Meyer, who is the Risk Communication and Community Engagement Consultant with UNICEF South Africa. And then finally, we will have Mr. Bernard Ray, who's the Head of Cooperation of the EU in South Africa. So you will agree with me that it is really a privilege to have such esteemed speakers. We're really privileged to have the wonderful organizations of UNICEF and the EU involved. Dr. Bernard Ray is just having some technical difficulty at the moment, but we hope to resolve that by the time he speaks. So I'm now going to sign off, and I'm going to hand over to the esteemed Dr. Emmanuel Opong.
Thank you so much, Bruce, and thank you for giving me the opportunity to join you on this very important topic, which has carried my life for the past 30 years, working to address the issues of water supply, sanitation, and hygiene. And I want to thank all of you who have joined us in this crusade in seeking to make sure that no one is left behind in the area of water supply, sanitation, and hygiene. I have a few points I want to share with us so we can dialogue around that. I know the esteemed members of you who have assembled here have all had experience and encountered issues around water supply, sanitation, and hygiene. So these are a few points just to generate a debate and discussion about how we all can work together to ensure that the right to water, sanitation, and hygiene is available to everyone, everywhere people are. So go along with me as I share these few slides with you. I would want to say children have right to wash, like any one of us, especially like Bruce had indicated. If we leave children out, we create conditions where over 800 kids die every day as a result of wash-related issues. And for those of us who are involved in this ministry, it's important that we work together. So I'll put a small outline for my presentation, a small introduction. I give a basic truth and the Sustainable Development Goal 6, which calls for universal access to water for everyone, everywhere we work. And water as a human right, why is it so important that it's a right to everyone, together with sanitation and hygiene as a human right? Some key facts, and what World Vision together with others have done over the few years in this region and globally. And I want to conclude with an interesting story of a boy in Malawi, who depicts the importance of making sure that whatever we do is child-friendly, is disability-friendly, and is gender-friendly. So these are key facts or key truths that I think all of us cannot deny it. We all know that no water, no life. If we do not have water, there's no life. And water cannot be substituted. Water also has multiple use and multiple uses. So it's not only used for drinking, but used for various purposes. The SDG 6 call for universal access. Everyone, everywhere needs to have access to water, sanitation, and hygiene. We all know that the United Nations in 2010 passed a resolution 64292 declaring water as a human right. But then they realized that if you have access to water and the environment where people live, or the community or the school, or wherever people are, they do not manage their waste, particularly the human waste, then the likelihood of compromising the quality of the sources of water and therefore making it much more dangerous to the community. And therefore, the need to ensure that it's not only water, but sanitation, hygiene, and more so now with COVID, it behoves on all of us to begin to ensure that there's access to water, sanitation, and hygiene. I put this diagram together to show the emerging sectors that water play a role. As I earlier indicated, water is used by many people and many industries, and it has a role to play in ensuring that if we are responding to disaster, we need water, sanitation, and hygiene. Issues around people with some forms of disability, very important. People with HIV/AIDS need to have access to water, safe and clean water, so that even if they are antiretroviral drugs, they can use their drugs. They need to have access to sanitation because of the physiological changes that might occur. There is a need for them also to have sanitation services. And Bruce had indicated issues around menstrual hygiene management, particularly the girl child denied access to water, sanitation, and hygiene could compromise education, and therefore it's important for us to look at that. We are also aware of the hospital environment. Maternal and child health plays a role. So as I indicated earlier on, when we talk about water, it intersects with every sector and contributes significantly to the well-being of every human being. And that is why those of us here need to be committed and join that crusade to make sure that everyone everywhere has access to water, sanitation, and hygiene. Some key facts, and I know my colleagues in UNICEF and European Union will be giving some key facts around the current status of water supply, sanitation globally and nationally and regionally. So I just chose 2 facts. 1 in 3 schools in South Africa does not have access to clean drinking water and sanitation. And you can imagine the implications of that. 600 million children lack basic drinking water service at school in 2016. Significant deprivation for these children who need an environment that allows them to study. And with lack of water supply and sanitation, then you deprive significant members of our society who are the future leaders of our countries. So, you find me with this little girl. That's my story for the past 30 years, where I have been so much devoted to the water industry. That brought me to this region almost about a decade ago. And I took this picture in Zambia when we began our WASH intervention to scale up our WASH program in the Southern Africa, the 9 countries, including South Africa. And I saw this girl with a sister fetching water from this pond. And it broke my heart. And I decided to take this picture to really it reminds me of my own sister 50 years ago in Ghana. I was living in a village in the eastern region of Ghana, and my sister, like this girl, went to look for water. We didn't have safe water, and my sister drank it because she was younger than me. She contracted diarrhea, and we were so far away from the hospital that she succumbed and died. So anytime I talk about water supply, and I get a group of people like you've joined me, we are not just providing water, we are saving lives. So if you leave this forum and somebody asks you, why are you so passionate and committed to advocating, to contributing, to engaging in issues about water supply, just tell the person you want to contribute to save life. And this child reminds me. And so for the past 5 years in World Vision, this has been our contribution, 20 million people with access to safe water. And I tell my colleagues, it's not safe water, we have saved lives. And in our region, 3.5 million people with access to water in the 9 countries where we work in the Southern Africa region. It is not just water, but it saves life. And like Bruce also said, we have become one of the largest global providers of water in Africa. And I always say it with humility because we do not do it alone. We need people like you who have joined us that collaboratively and in partnership, we can ensure that everyone everywhere have access to water, sanitation, and hygiene. For us in World Vision, every 60 seconds, we are able to provide water for a family because we have a global scale of providing water in the countries where we work. Bruce had already indicated 70 countries, and we work in these areas. And in our region, we do provide water, and you could see the women there just providing water, frees them to be able to use the water to engage in economic and livelihood activities, provide nutrition from their children, and provide money for the kids to go to school. That's an amazing contribution. I hope that as you join us, together, we can expand our growth. And for the past 5 years, we've also provided over 1,392 schools with clean drinking water. 1 million kids have gained access to hand washing facilities, which are critical for ensuring their well-being in the schools that they attend. Also, over 2,500 schools, we've provided hand washing facilities for them. And we have facilitated together with our partners like UNICEF, like European Union, wash clubs in schools to help kids learn on how to wash their hands so that they can carry on and become messengers for their communities. The beauty of it is this year, World Vision has decided in FY 2021 to 2025 to participate with other partners in providing and scaling up our water supply, sanitation, and hygiene in 41 countries globally. With a total budget of $1 billion together with our partners. And our focus is in communities, schools, healthcare facilities, and municipalities, because this is where we find the most vulnerable people. And our role is to work with them so that together we can provide water supply, sanitation, and hygiene for them. As I said earlier on, to be able to provide universal access to water supply and sanitation, no organization can do it. And I always tell my colleagues in World Vision that we need partners, we need to do public-private partnership. And this is what we've been doing, working with local government, national government, international and local NGOs, and that's why you find our colleagues and partners like UNICEF and European Union working together with us. We also work with private donors. We also engage with academic and research institutions, ensuring that whatever we do is backed with theory behind it, because the industry of water supply in the 30 years ago when I joined have changed. It used to be for only engineers, but now we have social scientists, help people, everyone is involved, and everyone needs to be involved. Let us not leave anyone behind. And therefore, thank you for coming to join us. Another area we also focus on, and I want to encourage all of us, is as donors give us money, they want to see evidence and impact so that we can show results that if we have touched 3.5 million people or kids, how many of them lives have changed? And so we want to show evidence and impact in our work. And we do that working closely with other partners and other research institutions. As I already said, the industry has changed, and therefore we need to build the competencies and the skills of staff who do the wash industry, making sure that whatever we do is sustainable. We don't want to request for donors' money, private donors. That we provide a water system, and then in the next 3-5 years, these systems fail. And most of us are aware that by the third year of any water supply program globally, particularly in sub-Saharan Africa, over 30% of the systems break down. And therefore, it requires new ways of ensuring that whatever water systems that we provide, sanitation systems, facilities are sustainable, both in terms of the infrastructure and the services. And that is why we call you to join us together so that we tap into our collective knowledge, skills, and expertise to work together to ensure that we can show evidence of impact, we can build the competencies of those who do wash programming, and also ensure that whatever investment that we make in the area of water supply and sanitation are sustainable beyond our lifetime to serve generations after us, so that no child dies as a result of lack of water supply and sanitation. So let me now share with you the slide, the video of our little boy in Malawi, and then I'll open it if you have some questions for me. Join me as we travel into Malawi and listen to our boy, Julius.
Children. Our future lies with them, and they deserve every chance to have a strong foundation in life. Our vision is that every child deserves clean water and access to sanitation and hygiene. What we discovered as we were building latrines, hand-washing stations, and water points throughout Southern Africa is that we were leaving a few children behind. In fact, there are over 5.4 million children with disabilities in Southern Africa alone. World Vision has been researching and developing wash solutions for children with disabilities for many years. So, in the town of Matope in Malawi, we took an extra step that made it easy for this young boy to take all of his. For children with disabilities, accessibility to something as simple as a latrine is the reality they have to cope with every single day.
Julius, when he looks at himself, he feels he's in the same level of the fellow learners. It was difficult for us to assess the disability kids here at school because of the poor latrines we had, but now the new latrines have assisted us.
The children who have a bit of disability, the facilities that were provided in the schools were not inclusive enough to allow them to use the facility. One of the innovations from the Learning Center was helping the national offices to address the needs of disability, especially for the children in schools.
Our vision is to continue to help every child, including those who need a little extra support.
I've known this young boy for 3 years, and he's clever. He's playing football. attending classes each and every time. So he's just a good boy.
We believe in a world where children, no matter where they are from or what circumstance they are born into, can experience life in all its fullness. Every child deserves clean water.
Thank you so much for taking time to join us and dialogue around this important issue. I want to leave you with one thing which is so dear to me. Join all of us in ensuring that no child dies as a result of lack of safe water, sanitation, and hygiene. And you can play that role in various ways, using your voice, your network, your expertise, your wallet, talking to your neighbors, friends, and colleagues. Let us galvanize and be advocate for us to address within our lifetime lack of access to water, sanitation, and hygiene, and save lives of children who need to take over from us. Thank you very much. Bruce, over to you.
Thank you so much, Dr. Opong. Also, thank you for sharing with us the story about your sister. And although we've worked together for a little bit, I'd never heard that. And it brings it so close to home, doesn't it? The reality of the fact that no water, no life, and that how you summed it up by saying we're not just providing water, we're saving lives. And I really, really appreciate that. For the people who are online and listening in, if you have any questions, please really just type them into the chat and we will attend to them. And then if you haven't done so already, I'd love you to just write your name and what organization you're representing in the chat. So there was a question from Angie just saying, how do we get access to water tanks for communities? And this is a challenge that we all know if we're working in the WASH space. The reality is we need to raise awareness in government, in local government, specifically in corporate South Africa or wherever your organization is, because we need to raise funds in order for us to do this. And there are many amazing organizations, of which World Vision is just one, who are active in this space in finding where there is a need and then doing the appropriate delivery of not just water tanks, because it's easy just to go and put down a tank, but then you've got to ask the question, how do we sustainably keep that tank full of water? So is it about then going and putting in a borehole? Is it about ensuring that you have a weekly delivery of water via a water tanker or some other means? So it's a difficult thing. I'm sure Jojo Tanks, which is a South African water tank supplier, gets requests probably on the hour to say, please donate. And they don't do that. They work with organizations like ourselves. So it's really just a call out for us to ensure that we engage with corporates and let them understand the extent of this need. We do have Janine from UNICEF talking later, and World Vision is currently busy with a project. In fact, the question will relate specifically to Soweto. We're busy with a project where we've been providing wash stations in response to the need around COVID for school children to have access for places to wash their hands. So there's been a wash station designed, which is essentially a water tank that has 4 wash tanks, wash points, so taps around it, access to soap and sanitizer, which ensures that school children in their schools can maintain the hygiene required. There's a question from Brian. It says, how do you ensure sustainability of wash infrastructure and services at the community level? This is a big challenge for most WASH innovations. So, Dr. Opong, I'll let you answer that. How do we maintain the serviceability of the infrastructure we put in?
Yeah, one of the Bruce, can you hear me? Can you hear me?
Yes, we can hear you perfectly.
Okay, sustainability is one of the challenges that has been in the industry for many years, and with learning from both academia and research institutions and practitioners like you, we have come a long way in knowing what to do. The key to addressing issues of sustainability begins right from the start of the program. You need to do a lot of assessment in ensuring that the technology and the services you are going to support, to provide in a particular area, they have the right skill set, knowledge, resources to do that. Sometimes organizations are quick at fixing the issue without looking at the potential characteristics or criteria required to ensure the sustainability of the system. It begins from one we call in the industry, they talk about the social sustainability part of it. What are the social infrastructure that you are putting together to ensure that that facility or that technology can be maintained? You are looking at the financial sustainability part of it. How much does it cost? And with the life cycle cost now, whatever system that you're going to put in place, you need to use the life cycle cost to be able to help you to look at the various key 5 components of the life cycle cost: the initial costing, the operation and maintenance cost, the ongoing monitoring and supervision, and then sometime to come, some aspect of the facility will break down, like it happens to all of us who have access to vehicles, motorbikes. We need to put in money for repairs and maintenance. In the same way, you need to build those competencies and capabilities within the community. And if you just ignore it and you are just interested in providing a facility or a service, then the likelihood of it being sustained. So it's a whole skill set that needs to be worked on right from the beginning. You don't think of sustainability at the end of your project. You begin from it and you work with the beneficiaries or the communities or the people right from the inception to closure or the time your funding ends. But then you would have built the capabilities around the ability to maintain, sustain, back to the necessary financial resources. And I know in World Vision, some countries are using microfinance institutions to be able to help support. In Zambia now, we are even looking at areas around insurance schemes, because some of these water systems now are mechanized systems. They are going to cost communities more money than they could afford maybe in 5 years or 6 years, when they need to replace maybe some significant part of the water infrastructure, like the underground pump or the tank or the solar panel. And therefore, an insurance schemes like professional insurance in Zambia is working with us to ensure those key elements, and the communities are using their community contributions, are able to pay the premium, so that when any of those parts break down and proper assessment is done, the insurance company pays for that. I know some of us are concerned about insurance, but it is working. In Kenya, we have also started. So we have to look at sustainability from social, the environmental part of it, because climate change is having significant impact on our water system. And if you don't address the environment part of it, the likelihood that in a few years your system can dry up. And so you need to develop the appropriate climate resilient approach to ensuring that your infrastructure can be sustainable. The financial part of it, the economic part of it, and all these go together to ensure that infrastructure will provide a sustainable. But the industry has faced a lot of challenges, because most donors just want to count the number of the water points constructed. And not enough resources is invested in ensuring these elements that are critical to ensure the sustainability. And therefore, all of us here, and I'm happy we all are here with a lot of skills and expertise, working together can address those elements of sustainability. Thank you.
Thanks, Dr. Fantastically comprehensive answer. So, I think what I loved about Dr. Opong's fantastic answer is just some of the innovation that's happening in this sector, like getting the things which we've put down for decades around areas of vulnerability. We're now saying, hey, how do we look after these things? So let's get involved with insurance. So this is a space, if we're going to make a difference here, all of us on this call have got to ask ourselves, how do we do things differently going forward? Because although we've helped so many people in the past, that's great, but the challenge remains. So innovation, how do we start to use technology in some of these spaces? Dr. Opong, thank you so much for your presentation. Thank you so much for sharing your personal story and the insights around what can be done with the right funding and the right intent from organizations like World Vision and the many, many other ones that work across our nation and across our continent. I'm now going to hand over to the wonderful Thulang Lecheko. Thulang works in the field with World Vision. He works down in the Nelson Mandela metropolitan area in the Eastern Cape, and he is working on a project that we do in conjunction with Ford, and he's going to share a little bit about this. And I love what we've done here is we certainly have the experts who understand policy and understand what's going on as we talk at an organizational level. But really where the rubber hits the road is in the communities where there are men and women and thousands of them across the continent, like Thulang, who put their careers behind solving problems. So I'm going to hand over to Thulang, and he's going to take us through what he's doing in his community. Thanks, Thulang. Oh, sorry, before you start, I just want to remind people, if you've got any questions or comments, drop them into the chat, and we will answer them at the end of the talk. Thank you so much.
Thank you so much, Bruce, and greetings to everyone on this platform. It gives me great joy to be part of this webinar today, so as to showcase the work that we keep on doing on the ground. We understand that there are several sources of water we have around the world, but today, allow me to showcase the innovation that we had in partnership with World Vision, in partnership with Ford, in partnership with Watergen, tapping into a space that has never been using, which is taking water from the air or converting air into drinkable water. Allow me to play this video at the start of this presentation so as to give a picture of the work that we continue to do. I thank you.
I am a project coordinator of a project called World Vision Ford Watergen project. We generate water through this Gen 350 machine. It is able to generate water, purify the water, then store it in a reserve tank of about 200 liters. There has been a drought for quite some time in this area. The water levels in the dams are about 20%, so that is why we have this Watergen machine, so as to provide clean and drinkable water to communities around here. We serve Nelson Mandela as municipality, but the main focus area is Uitenhage and KwaNobuhle. One of the core values of World Vision is partnership. We are committed to the poor, we are responsive, we are partners. We work in partnership with municipality, we work in partnership with other stakeholders that are surrounding the communities, like your education, Department of Health, and other community sectors. Ford has funded the whole project, and we also work in partnership with Watergen.
Ons het die water nie. Ons het niks nie. Ek was bly om te daai water te kry.
I'm still feeling glad when they have come to give us help.
Thank you so much. Now we will go straight into our agenda, or into the presentation about what we are doing on the ground. It gives me great joy to mention the fact at the start, the fact that out of what we are going to present to you today, there are other projects that are linked to this main project, which is about the provision of water to fragile communities. We understand that the theme for today's webinar, it is the right to safe drinking water. Chapter 2 of the Constitution of South Africa states that everyone has a right of access to basic water supply and sanitation, just like many parts of our country. Nelson Mandela has been experiencing intermittent water supply and disruptions due to the ongoing drought, as well as water supply deficit. Hence, we are having this project implemented in the metro. My presentation will consist of the following activities that are directly linked to the water supply project that we are implementing in the metro. First of all, we'll talk about water generation. Water generation using Watergen Gen 350 machine, and also the drilling of one borehole, which is something that has just been done as a part with a partnership, a local partnership that we have in the metro. Then afterwards, we will talk about the establishment of the ambassadors in schools and communities. Thereafter, we'll talk about the erection of water-saving billboards in high water consumption wards. We will then talk about school-based water awareness campaigns, sharing of water containers with schools, health facilities, ECDs, and communities. Please Fridays for water and COVID-19. It gives me great joy to share the fact that in a bid as well vision to provide clean, purified, drinkable water and education to fragile communities, World Vision has worked with schools, communities, early childhood centers, health facilities in providing clean, drinkable water. World Vision has not done that alone. Of course, we have partnered with Ford Motor Companies and have implemented an atmospheric heat exchange water generating system using a technology that is called a Genius. What is how is this done? How is this done? Humid air passes through Gen 350 air filtering system, which cleanses the air and removes dirt and dust. The clean air then enters the into Genius, where it is cooled to dew point and then harvested into water. The water is then filtered, because we know and understand that not every water that has been generated is drinkable. It has got to go through a process of filtration and cleansing. Then the water that has been generated by the machine is then collected through a collection tray, then taken through a process of filtration. The water is then filtered and purified via Gen 350 filters and UV lamp, and essential minerals are also added to the water to make it ready for drinking. Then that water is stored into a storage system, a water container or a reservoir, which is inside the machine. For this machine, or for the size of machine that we are using in the metro, the machine is able to store about 200 liters. Then we transport that generated machine to communities around. We transport it to schools. We transport that water to communities we transport that water to ECD centers, we transport that water to early childhood centers around the metro. So we have done that in the past, and it gives us a great joy to have seen lives of the people, lives of ordinary people out there, as we target the most fragile areas, the most areas that do not have water infrastructure. We have surrounding areas that we have impacted in the Nelson Mandela. You talk of the areas such as Dale, you talk of Blue Cliff, those are farm areas, those are outskirts of Nelson Mandela. Some of those areas do not even have water infrastructure erected or established by the municipality. So we have touched the lives of those people. We have even we have even impacted the lives of ordinary people with various illnesses. But you will get that info as you get to know more about the project. Part of what we have done, it is to share water containers, sharing of water containers with communities and schools, early childhood centers, health facilities, to promote health and hygiene. You can see the containers that were donated by Plastic SA that we have distributed to communities. You can see little children there holding their 500 ml containers that they use, that were given to them by World Vision with safeguarding messaging and water saving messaging. This has been done in partnership because World Vision believes in partnership, and it gives me joy, great joy again, to mention the fact that World Vision is working closely with municipality and Department of Health to visit schools with a program to educate scholars about how to save water, using it sparingly. As you would understand that we are facing water crisis, so we have developed a motto that says reuse. Some of the water can be reusable. We reduce the water usages. Recycle. We can recycle the water that we have used for different purposes. And also part of the messaging that we send out there, it is COVID-19 awareness messaging. We have again, in sending messages out there or sending messaging out there, are working with municipality, in partnership with municipality, have erected a billboard with water messaging in high consumption areas. This has been done with the current partnerships that we have with the Nelson Mandela municipality to ensure that messaging goes out there in saving the water that we have and using it wisely and using it sparingly. Of course, the issue of sending messaging to people and to communities, to schools, is not only dependent on the erection of the billboards alone. We also have distributed posters, we have distributed stickers, we have distributed COVID-19 and stickers with water messaging and COVID-19 messaging to schools and to ECDs around. It gives me great joy. At the end of the presentation, you will then see how many schools and how many ECDs we have so far reached with our programs in trying to send a message out there of how people can use the water. Social media campaigns were conducted where World Vision continues to run social media campaigns along with Mafa Pavuma, who serves as an ambassador for the project. Mafa Pavuma is a well-renowned presenter of Umhlobo Wenene at SABC. So he's part of World Vision, driving the message out to the larger communities out there. For the focus of the campaigns is on water, conservation and hygiene, education through the education through the activation of tippy taps. What is a tippy tap? A tippy tap is a concept. It's a concept that uses little water, very little water, and is easy to build using a plastic bottle, strings, sticks, and water and soaps. We encourage young people, we encourage all people from various settings to build and to create their own tippy taps in order to promote good hand hygiene. But it is a blessing to mention the fact that young people can participate into a tippy tap challenge, UNICEF tippy tap challenge, even as we have partnered with UNICEF tippy tap challenge, where they can enter or participate into a platform that is called Zlato platform. So for more information, you will be given details, and we can engage as to how people or young people between the ages of 16 and 35 can participate into that platform to earn reward and continue to promote good hand hygiene and fight the spread of COVID-19. More water ambassadors were added in schools and communities. World Vision collaborated with the Nelson Mandela municipality to facilitate World Water Day campaign at Umhlobo Wenene, a BE morning breakfast show listened by over 3 million people. World Vision collaborated with Nelson Mandela Bay municipality and Mafapa Vuma to facilitate 13 pre-recorded ads with water messaging, of course, at Umhlobo Wenene, breakfast eyondlayo ekuseni show. So those that are listening, Umhlobo Wenene, they will remember this word or motto that says breakfast eyondlayo ekuseni. World Vision, along with municipality, GCIS, Department of Health, Traffic, Metro Police, RTT, facilitate weekly blitz Fridays to make residents aware of water crisis and educate them about how to use their allocated 50 per person water per day, as well as where they can report water leaks. This is the impact that we have had, and this impact is not only limited to what we have shown here, but it gives us great joy as the project to mention that an overall impact that we have had as the project. We have impacted with all our interventions more than 3 million people, more than 3,041,000 people with various projects that we have run in the metro. I would like to close with the fact that water is the most essential gift of human life and nature. It must be harvested, conserved, and not wasted. For the water we waste today, we shall require and need tomorrow. Anything that we waste today, we tend to require tomorrow. Why can't we harvest? Why can't we save what we have today? Because tomorrow is unknown to anyone. I have been working and I have been in there with the project since its inception in 2019, and each day has been full of learning, challenging, and yet fulfilling experiences. And I would like to thank World Vision. I would like to thank Ford Motor Company for the exposure to this exhilarating and life-changing experience. At Ford, they usually say, indeed, we go further with Ford, and the best is yet to come. I want to say, yes, water, physical water, can quench the thirst of a man, but what can quench the soul of a man? There is water that we can find even as we come to Jesus. We can find life. Thank you so much. You can play your part. You can play your part in quenching the thirst of our society, you can support the work that we are doing in many other ways. And I want to hand over to Bruce and thank you for your time. Thank you. Over to you, Bruce.
Thanks, Thulang. It's always a pleasure to listen to the passion that you have. So Dr. Stanley Maposa has just got a question there to say, is the messaging that you provide in local languages?
Of course, the messaging that we provide is in local languages, but when it comes to messaging that we have written, it be either on the billboards or on any other thing, it's in English. But most of the time, the messaging that we provide on radios, we use Xhosa. And locally, whenever we do Blitz Fridays, we try to reach people in their local languages, because the most prevalent languages in the metro is English, is Afrikaans, and Xhosa-speaking people. But the majority of the people that we have reached so far are Xhosa-speaking. That is why we have the ambassadors like Mafa Bavuma that are that are working closely with us so as to send the message across in a language that can be understood by people.
Wonderful. Thank you. Thanks so much, Thulang. So again, if there are any other questions, can people just pop them into the chat? I just want to say, so what I love about the Forward project that Thulang has been involved in is it shows that it's possible for us to come with left field ideas that satisfy the massive need. And for me, part of our advocacy is not only to be pushing governments to change policy and to widen their water distribution, but actually to be pressurizing tech companies and entrepreneurs and to use the tools that are available to us as we go into the fourth revolution to say, how do we start to look at new ways to desalinate seawater, to convert grey water at scale, and even wastewater. That's where the solution is going to be. We've got to come up with these new and exciting ideas, and it just feels like the time is ripe for us to get involved in a technological solution to some of these very practical issues. So Thulang, your passion, the fact that you just do it every single day on the ground is wonderful. And then just one more call out is to everyone on this group. You know, the Eastern Cape, which is home and the birthplace of many of our nation's leaders, is a hugely underinvested space in terms of corporate social investment and grants. The dams in the Eastern Cape at the moment are about 12.5% full. Access to water and drought there access to water is just in a dire situation. There's a massive drought there. So if your organizations can just say, is there any way that we can start to focus a little bit on what's happening in the Eastern Cape and provide some of the much needed relief there? So one of World Vision's amazing partners is UNICEF, and we've really enjoyed working with them right around the world. But in South Africa, most recently, we've done some great work around COVID relief and access to wash stations. So I now want to give Janine Simon Meyer, who, like I said, is the Risk Communication and Community Engagement Consultant at UNICEF, just to share with us some of her experience and the things that UNICEF are doing in this space. So over to you, Janine.
Thanks so much, Bruce, and thank you very much. Good morning to everybody. It's quite big footsteps to follow in Dr. Opong and Thulang with their passion and experience, and it's been amazing to listen to that. Thank you so much. From UNICEF's perspective, I think what's also been really encouraging to hear is how we are actually beginning to see the WASH issues with similar lenses, because some of the themes that have come through in the previous speakers in terms of rights and access, obviously, but also around innovation, are really becoming key now, and what we need to do differently. So it's really exciting to hear that from everybody. So if I can just, sorry, Mel, can I just confirm that the main slide is visible? Yeah, okay.
Not yet.
Not
there we
yet.
go. There
is that up now?
Yes.
Okay, good. Sorry, I was just checking. Okay, so from UNICEF's side, we are operating really under the framework right now of Reimagine WASH. And for this morning, obviously, reimagining specifically the right to safe drinking water and the right to safe water. And what's become even more, why it's become even more critical is that the climate crisis is a child's right crisis. We released a report just at the end of August, which was the first of its kind, the Children's Climate Risk Vulnerability Index. And it really showed that at the moment there are 1 billion children living in extremely high-risk countries, countries where the climate change is going to have significant impact on their quality of life. So the risk index showed us, if anything needed to be shown even more, how important it is to get this right for children. In South Africa, as we all know, and as Bruce has just highlighted again, and Thulang, drought is a national disaster. It was a national disaster before COVID, and it is again now. Regions have just been declared disaster areas again. And as has already been said, climate change and extreme weather deplete and contaminate the water supply, and unsafe water and sanitation leads to malnutrition, which children in South Africa really can't afford. We already have more than 27% of children who are stunted in South Africa. Add unsafe water to that, and the malnutrition and stunting rates will be even more alarming. And then on top of this existing awkward and difficult situation, COVID kicked us. And all of a sudden, hand washing became a mainstream topic. And we had to look again at the fact that 18% of rural households and 10% of urban households had no access to hygiene services. And quite obviously, the point that has been made a lot in the last 15 or 16 months is that no wash, no hand washing. And many people can't take the most basic step to protect themselves against COVID. Unsurprisingly, in a survey that we ran with youth community radio reporters, only 36% of them said that they'd washed their hands more than 5 times the day before. This was very early on in the COVID epidemic. So you can see the impact of not having access. It's the major barrier. And obviously, if we get wash wrong, we were reminded by COVID, we have an even more devastating impact on children in terms of the spread of disease than was already the case. But what we do know, and this again from our index, is that investments that improve access to resilient water, sanitation, and hygiene services can considerably cut down their risk, the climate risk for children. And in fact, 415 million children can be positively affected if we get this investment in access right. But here in South Africa, faced with COVID and faced with the existing drought conditions, we had to make hand washing possible. We had to do something. And this is the point at which UNICEF's WASH program started to scale up. There had been something in place in South Africa, but it really gathered speed with the onset of COVID. And there were 2 pillars to the whole WASH program. The first is infection prevention and control, basically through hand washing stations, which Thulang has alluded to already, and we can speak about in a little more detail. And hand washing with soap, I might add, and also wash kits. And the second pillar is risk communication and community engagement, which in any health emergency is absolutely critical, because the access to accurate and timely information and the opportunities to actually interact with the authorities who are responding are both essential pillars of an emergency health response anywhere in the world. That's what needs to happen. So our RCCE related to WASH was around promoting hand washing, yes, but also general COVID prevention and accesses to other ongoing health services, which are so essential. But what to do? Because it was an emergency. Those of you who are not in South Africa, but I'm sure had very similar experiences, it was level 5 lockdown. We all had to not move out of our homes. How to get anything to anyone was quite a challenge. And obviously the answer, which has been stressed by everyone, is collaboration and partnerships. We had to work closely with the National COVID Command Center and the WASH Technical Working Group associated with that, with all the provincial and local government authorities, and then with service providers. And in this instance, the CEO network, the corporate network that UNICEF had been building in South Africa for several years, actually came into action because companies there that were able to install stepped up to the plate and with speed. So there was ability to do an emergency response very quickly, despite the fact there was level 5 lockdown. And the result of that initial surge of action was under the first pillar that we installed 106 of these JoJo tank hand washing stations. And you can see that there's a particular design there up on a stand. They have taps, they have basins, and we can speak to those in more detail later if necessary. And also 10,000 wash kits were distributed to extremely vulnerable households. And the big thing to say here is thank you, World Vision, because this was through our partnership and through the many different elements that had to come into play in this partnership to get those kits packed, distributed, and in the hands of the most vulnerable households in the country. So an exceptional tribute to World Vision here. The second element of this initial surge response was some of the basics around COVID prevention that went in with the hand washing stations. We had special social distancing markers developed. We had behavioral nudges, RCCE type nudges, to encourage people to adopt the hand washing behaviors, and also the social distancing around the hand washing station. So those were the two initial kind of areas of response. And the next step obviously was partnerships. And World Vision was really the partner that did the biggest program, the biggest WASH program with us over the last year. And it has been an exceptional experience. Working with Thulang and Poncho and others has just been extraordinary. The thing is that in addition to providing the access and improved access to water, we also saw WASH as an entry point for this critical communication that I referred to earlier. And the partnerships people need to be in place to conduct the communication. And by doing that, you also build local ownership and strengthen resilience. And World Vision, again, was able to connect up with local CBOs who carried out many of the project activities. And we've learned over the months have actually put down roots and been strengthened. And some of this resilience that we were hoping to build, World Vision has told us about, which has been extraordinary accomplishment, again, with their management and support of this. The approach was really to embed the response in the very local areas and to use local voices that Thulang has just described. We amplify those voices on local channels like Mhlobo Wenene. So that sense of let's embed and go up and out is how this project kind of took wing, as it were, in the next phase. And just a key thing to mention here is the location. In fact, key word location, 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 because how do you choose out of all the areas that are badly affected where to put what? And in this instance, we used the CSIR COVID Vulnerability Index, which indicates a combination of factors that would lead to increased COVID morbidity and mortality in those areas. And that's where we could select from, I think there were around 200 or so across the country. We had to select from those where would be feasible to intervene and where we could work with World Vision to do so. And unsurprisingly, some of the highest risk areas were in high density informal settlements. By the time we shifted out of level 5 into level 4, there was a good process in place around communal and school sites. We were working with implementing partners and with local authorities and extended a lot of work into working with the Department of Basic Education. But as the weeks progressed, we also realized that location had to be carefully reconsidered. The broad location as to where we were working was solid and proved to remain so throughout the intervention, and we will be continuing work in those areas. But where to site the hand washing stations, we had to think very carefully about. And coming back to the point about sustainability, the refilling costs, the costs of refilling these stations with water, particularly with tankers, which was the way that they were refilled in the beginning, is exorbitant and unsustainable. And we literally had local authorities turning down the offer of donated hand washing stations because they could not sustain the cost of refilling them. They hadn't planned for them in their yearly budget, in their annual budget. They couldn't connect them in any way and they couldn't service them. So they started to refuse the hand washing stations, and we had to think more carefully about how better to site them in a way that would be sustainable. And the shift was to linking with institutions and to giving some sort of institutional framework around the hand washing station that could attend to the maintenance and the sustainability of it. Specifically schools, also healthcare facilities. And the other element was working at household level, which Thulang has spoken about to some degree, and we'll show you a little bit more about later through the tippy taps. And the result of that shift and the overall project as we stand now is a total of 424 hand washing stations that have been installed in the most vulnerable communities around the country. Most of them are in schools, and the reach is around 268 people directly by just those hand washing stations. The associated RCCE that went with this reached many more, millions more actually, if you add in the radio as well. So that is something that we've been very pleased about and excited about what World Vision has been able to achieve with this. We also had a look at how we did, again with World Vision's support, we did an end user monitoring survey of what end users actually thought about these hand washing stations. So what does it look like a year or so down the line if you're looking at sustainability? And what they told us, 83% of the respondents said they were satisfied, and 81% said that the hand washing stations always had water. I mean, these are very high, but they're not complete, but they were encouraging responses. More encouragement came from these responses where people were saying, of the people we spoke to, they thought that the hand washing stations were accessible to people with disability. So 87% of our respondents said that. And 94% said that they were very accessible to children, and the elderly 92%. Also encouraging was that the RCCE basic interventions that were in place around the hand washing stations were noticed. These were the social distancing markers and the stickers. So over 90% of people actually noticed that. And also encouraging based on responses and some of the observations that the enumerators made during the survey was that the messages that were intended by those RCCE interventions were understood. We had additional benefits from installing hand washing stations, which is deepened understanding of what the dynamics around hand washing and access to water in a community is. And these came largely through household level surveys conducted by partners, which gave us great insight into barriers and drivers of behaviors. The other thing that came up, and that's this theme of innovation over the last 15 months, just having to find ways to do things despite COVID, doing online RCCE training with CBO implementers, bringing youth voices to the fore and amplifying them on channels that perhaps they'd never had access to before, and identifying through collaboration with CBOs and with young people in local areas, close working with them, and also street committees and various other organizations at local level to find the most vulnerable households to attach to and connect with and support. And this innovation and capacity building happened at many levels. It happened through our implementing partners. We've heard from World Vision how they benefited in many ways, and the CBOs that were associated with the project, and also at individual level, and also UNICEF. We learned a lot. We learned a fortune through all of this. So it's a kind of collective learning process that with every step that we took, we found out more. But it's not without problems. In terms of sustainability, as we said, 17% of the hand washing stations were not working. And most people said, 62% of people said that was because they had no water. And 80% of people said they washed hands, but in 30% of cases, there was no soap. So, these are ongoing problems that have to be addressed if hand washing stations are to be installed and access to water is to be improved. It's got to be looked at in the long term. Interestingly, when we did the survey, there were stark differences between the provinces. You can see in Gauteng, the levels of functionality were excellent, and in Western Cape, far less so. The reported functionality as being negative was around 71%. And the other issue is that it's not always accessible. Some of the taps were found to be too high for very young learners, and innovative action had to be taken to help them access the tap. And Melanie Wilkinson took action of her own. She's our WASH consultant, and I think is here with us, to actually build a set of steps and take them to the school so that the school had a permanent and more easily useful resource to help young learners actually access those taps. And obviously, if a center in which the hand washing station is located is closed, then that water can't be reached and it can't be used. So there are limitations to locating hand washing or storage tanks within institutional frameworks as well. So taking a step back overall, what we learned working through COVID with World Vision and trying to improve access to water was that you can use these hand washing storage facilities to provide rapid improved access to water. It takes maybe less than a day to install one, considerably more time than that to plan where it goes and to get the collaboration and support of everybody, but a lot more around sustaining it after that. The installation and the improvement of access can happen in the most vulnerable settings very quickly. It can go along with communication interventions that address particular behaviors and try and encourage preventive behaviors that would be helpful, and also development interventions to improve skills. And by putting in a permanent improvement in material conditions, it's an opportunity to activate the communication and the other behavioral type work that is really important to go along with this. It also, as we've said, it's an opportunity to do more household level work because the interaction with the community becomes much more dense, as it were, and it's easier to identify particular people who really need it. And to build sustainability, some of the things that became absolutely clear were partnerships are essential. Again, another theme that's been mentioned a lot. Institutional ownership around any kind of hand washing or water storage facility is going to be essential. And even more critical is just making space for local practical solutions and supporting them and enabling them to be taken and to happen. Because there's no ways that this can be only solved at national policy level. It really has to bring together local players. So where do we go to from here? And thinking on what Bruce has been saying all along, we as UNICEF are looking obviously at SDG 6 and how we achieve that. And we know and we want to build on the partnerships that we've built and sustain the youth involvement that we have. And as I said at the beginning, our framework at the moment is Reimagine WASH to achieve this. And I think that's our call to action to everybody here today, is to reimagine how we can approach WASH. As UNICEF, what we're wanting to do is to put children and young people at the center of WASH systems and to use technology and innovation to build understanding and ownership. Because without children at the center, their futures can't be secured. And without understanding and ownership, they won't be sustained. And without the ICT and innovation, we are just going to miss too many opportunities and not achieve our goals. So that is our call to everybody here in the room, and thank you very much.
Wonderful, thanks. Thank you, Janine. That was amazing, and just a real opportunity to see the impact that UNICEF has, not only on our country, but your organization does it again and again and again right throughout the world, and it's a privilege for us to work with you and many other organizations like ourselves partnering with you and making a real difference to children. So we value what you do, and we look forward to working together more and more. Again, just a reminder.
I do have a little video, Mayor. I'm so sorry to interrupt.
Yes,
if you wouldn't mind, If we could just.
Part of the WASH program, it really has two arms. One is around improving basic access, and the other is around passing on
critical life-saving information, but also engaging with people and hearing what their questions and concerns are and putting systems and structures in place.
The area is surrounded by informal settlements. So when it comes to hygiene and observation of health and hygiene is still a struggle.
There is no proper infrastructure in place, no running waters, no proper sanitation. That poses as a health risk to the lives of children living in this community, especially when one of the ways of combating COVID is to do hand washing.
So our involvement is around improving access to water and sanitation facilities for communities in very high-risk locations across the country. We want to protect people from COVID and help prevent the spread.
TippyTap is a concept that saves water. It is a concept that is easy to build.
We thought that this was an opportunity with COVID to improve immediate access to hand washing facilities, involve young people, and then connect them to a platform where they could get rewarded and earn benefits by building the TippyTap, but also get linked onto the other benefits that are available, the other learning opportunities and skills building opportunities that are available on this Lato platform.
We saw the
Oh, the video cut out. Do you want to restart it?
I can. I'm not actually sure what happened here.
Okay. No problem. We've always got to have some technical challenge.
Okay, let me have a see if I can just take you past that point.
To him, it's the TippyTap. So it really comes in very handy to communities such as this.
Whenever you do it, and then you can take an image and put it on Zlato, and then you claim the prize. You can also go to shop with the prize that you got from Zlato and redeem it. Then you're going to get a discount.
For me, I just found it very inspirational. It would encourage people to be more hygienic, to take better care of themselves, especially in the case of the pandemic.
This initiative has brought a lot of change and a lot of impact in the lives of people, because people initially could not be able to wash their hands, could not be able to even buy soap. Having a TippyTap around their household, which is easy to build, has brought a lot of improvement in their own lives.
Thanks, Janine. I love that video. It's really good, and obviously that will be shared as part of the content that we're going to share with everyone who's on this call and the people that have signed up but haven't actually made the call. It's actually lovely to see Jean Smulders on the line. I wonder if he's calling in from Zambia. Jean was absolutely instrumental in UNICEF's relationship with us and the practicality of rolling out these tippy taps. So lovely to see you. So the big question is, whose responsibility is solving access to water? Is it the community that has the problem? Is it the country who's responsible for governance in that environment? Or does it lie elsewhere? And it's so wonderful for us in South Africa to have the eyes and the hands and the finances of the world looking to solve our problem here. And it's been a pleasure, again, over the last year to work with the EU and the EU delegation in South Africa to solve some of these issues, to attend to some of the challenges of the communities in which we work, access to water, access to hygiene. So we had intended to have Bernard Ray, who is the head of cooperation at the EU in South Africa, to talk to us. Unfortunately, as luck would have it, he's having technical challenges. But we've got the wonderful Melissa Chuma Ndungu, who is the policy officer at the EU delegation, and she's going to take us through the presentation just to show us the involvement of the European Union in our beloved country. So over to you, Melissa.
Thank you so much, Bruce. Good afternoon, good morning, everyone. It's still morning. Thank you for this opportunity. Today, I'm going to read Bernard's speech that he would have given today for the webinar. So the speech is going to give an overview of what the EU has been doing in the water sector, and is going to just touch on a few of the projects that the EU has had. Most of the information that I will be sharing with you today is from the EU document that will be shared with the participants of the webinar. The EU interventions targeting water and sanitation impact multiple sustainable development goals and support national and international commitments for the greater well-being, security, and resilience to risk in communities across multiple regions. The paper shared with you today stresses that water is important for the priorities set by the EU and its international partnership agenda, that being migration, Green Deal, governance, peace and security, innovation and inclusive, digitalization, growth and jobs. Public and private institutions provide finance, expertise in the water sector and are simultaneously creating jobs and growth, and making financial returns by extending and improving water and sanitation services and increasing the productivity of water management. The paper shared with you today also proposes to structure the EU interventions along three interrelated specific objectives: preserving and sustainable managing water resources. As you all know, water is an indispensable resource for all economic activities and closely interlinked with energy needs and food security, water-food nexus, which I will talk about later on, as well as the sustainable ecosystems and services that they provide. As you all may recall, in 2018, Cape Town had what they called a day zero. And in part, Cape Town never actually got to day zero. And this was because authorities implemented water restrictions throughout the period, banning all outdoor and non-essential water use, and non-essential water use, and encouraging toilet flushing with grey water, and eventually limiting consumption to 50 liters per day in February. The level of this conservation of water was foreign to many residents of the coastal tourist destination. This water crisis motivated the European Commission Joint Research Council to publish a short technical paper about this situation. The second objective is water for peace and security. The EU intends through its water diplomacy to increase diplomatic engagements on water as a tool for peace, security and sustainability, and for enhancing resilience for societies and economies. The EU is committed to promote transboundary and integrated water management, as well as effective water governance. The third objective is universal access to safe and affordable water and sanitation hygiene. The EU intends to continue promoting and protect the human rights to safe drinking water and sanitation. EU interventions in the field of water and sanitation have an inclusive approach and emphasize the principle of non-discrimination and leaving no one behind, as per the EU Human Rights Guidelines on safe water and sanitation. It's important that EU interventions are based on robust understanding for gender-specific needs and of the barriers that women and girls face, as alluded to by Dr. Opong in his speech. When striving to realize the rights to safe water and sanitation, including the menstrual hygiene management. Safe and affordable access to water, sanitation, and hygiene is a fundamental means for combating waterborne diseases and preventing infectious outbreaks, and more in general, a requisite for sustainable, healthy, and prosperous societies. Efficient water and sanitation facilities and water collection and treatment plants are the cornerstone elements of green cities and play a role towards the achievement of the Green Deal objectives. The human right to water and sanitation is a principle that acknowledges the clean drinking water and sanitation are essential to every person's life. It was recognized, as pointed out by Dr. Opong, by the UN Secretary General Assembly as a human right on the 28th of July, 2010. While progress has been made for most of the Agenda 2030 targets, the world is currently not on track to meet Sustainable Development Goal 6, clean water and sanitation. Access to water, sanitation, and hygiene is a human right, yet billions of people worldwide are still facing the challenges of accessing water. Worldwide, 3 in 10 people lack access to safely managed drinking water. 4.2 billion people lack the access to safely managed sanitation services. More than 80% of wastewater resulting from human activities is discharged into rivers or lakes or seas without any treatment, leading to pollution, marine litter, and waterborne diseases. Half of the world's population is already experiencing severe water scarcity, at least once a month in a year, leading to overuse and pollution of surface and groundwater. The second part of my speech today is just to highlight to you the relationship that the EU has had with the water sector in South Africa. In the year 2000 until the year 2011, the EU had a project called Masibamba Nani. It had 3 phases of a total of 336 billion that was implemented to focus on the water and sanitation health. Part of the achievements of this project for over its 11-year tenure was providing clean water to approximately 1.9 million people spread across 4 provinces, Western Cape, KwaZulu-Natal, Mpumalanga, and Limpopo. The rehabilitation and the extension of existing water and sanitation schemes across the 4 provinces. And lastly, the provision of health and hygiene education, as well as sustainable water infrastructure to approximately 2.4 million people across the 4 provinces. The other project that the EU has been involved with in the water sector, another notable one, is the support to transboundary waters in the region of the Orange Senqu River Basin. It provided the EU with a contribution of 5 million euro. This project's name is the Cooperation in Transboundary Waters in Africa, and is managed by the World Bank. This project is likely to be scaled up with a focus on the nexus, which includes the resource of the basin of the holistic manner and putting in place cross-sectoral policies and projects. This transboundary river basin is focused on 4 countries and will have a very SADC approach to it. As the European Union, we also support the United Nations Economic Commission for Europe since April 2019 to support the prospective members in understanding and implementing Water Convention. The project aims to provide technical support to interested party countries who request assistance in the accession process of the convention. This project is amounted to at least 5 million euro. Another project that we have at SADC level, together with the Embassy of Germany, is the Nexus Dialogues program. This program started in 2015 and is approximately 6.17 million euro. The first phase of the action aims to strategically steer ongoing and newly established demand Nexus policy dialogue approaches, bringing the discussion on the nexus of water, energy, and food at ministerial policy levels, and strengthen regional and national dialogues on water, energy, food ecosystem nexus, but will also support the preparation and the financing of bankable projects under the thematic blending facility, indicatively 1 project per region. The EU has also worked with the University of Stellenbosch, with UNESCO, to develop a paper and to launch the World Access for Water for South Africa. A human rights approach is an important way to strengthen accountability and ensure access for unserved populations. The core to this approach is empowering the rights holders and building the response capacity and accountability for duty bearers. The voice of civil society has been a much needed one in the light of the COVID pandemic. That highlighted the gaps between basic service delivery, especially for the most vulnerable societies. CSOs are a vital element in the communities that they serve to keep governments accountable and to ensure that the citizens have a voice. COVID-19 has brought renewed attention to the crucial contribution of water, sanitation, and hygiene to human health, and to related mounting challenges such as microbial resistance. This brings me to touch on the grant that we have with the World Vision South Africa. Most recently, in the midst of the COVID-19 pandemic, South Africa, like other countries, was trying to advance WASH initiatives. WASH being the water and hygiene and sanitation initiatives to try and contain the spread of COVID. The delegation signed a few grants with CSOs in an aid to continue to support increasing access to water, sanitation, and hygiene. The grant with the World Vision has the objective of improving health to vulnerable communities across 3 provinces by reducing waterborne diseases using safe and sustainable practices. The tenure of the grant is 24 months, and the objectives of the grant is to hopefully provide 16 schools, 8 health facilities, 16 central community points with water storage facilities, provide 8 healthcare facilities with appropriate medical waste management infrastructure, and to supplies to prevent further spread of the virus, to install 40 hand wash stations and provide hygiene supplies and strategic points within communities, health care facilities, and schools, to provide 5,000 vulnerable households with cleaning and hygiene kits and promote the use of locally made tippy taps within the household for hand washing. Another grant that we signed as the EU during the same period was a grant with IBP, International Budget Partnership, by the name of Asivikelani, which translates to "we must protect each other" in Zulu. That directly targets the provision of the basic services of between 1.5 million and 3 million people in informal urban settlements. This is done by citizens monitoring water, sanitation, and refuse removal, conducting diagnostic research and underlining public finance failures that cause service delivery problems, and facilitating direct engagement between government and citizens to find consensus-based approach to these problems. The last example is what we call at the EU a dialogue facility. This particular dialogue is with the Department of Water and Sanitation, with the title, "The Impact of COVID-19 on the EU and SADC Water Research Agendas and Capacity Building Activities, the Prospect for Increased Resilience and Effective Post-COVID-19 Recovery." The dialogue intends to gather information and facilitate the exchange of knowledge, solutions, and best practices on how the EU and SADC WASH research and development and innovation sector has organized itself to contribute to the national response to curb COVID-19 pandemic, maintain the research and capacity building activities, and develop strategies to build resilience and facilitate recovery post-COVID-19. In closing, the right to safe drinking water is pivotal. Water is essential to human life, human dignity, and the health of people and the planet. It is an indispensable element for all three pillars of sustainable development: economic, social, and environment. Key multilateral agreements to which the EU is signatory stress the need to promote sustainable water resource management and universal access to water and sanitation. Water is also fundamental to build equitable societies for the most vulnerable people, and in particularly women. Access to water and sanitation dramatically reduces the burden on women fetching water over long distances, and access to sanitation in schools and is a precondition for girls finishing school and consequently access decent jobs. Thank you everyone for your attention.
Oh, Melissa, great job. Coming in at the last minute there and doing that is fantastic. So thank you so much. And it's we appreciate that it's never easy to read a speech and then you have a plane flying above you. So thanks for that. Most importantly, thanks to the European Union. You know, the work that they do with our government nationally and locally, the work that they allow many of our social impact organizations like World Vision to get involved in across the length and breadth of this country is amazing, and we appreciate the partnership. Again, we think it it's crucial to have these multilateral relationships with significant organizations like the EU, and we know that what you bring is more obviously than just your checkbook, which is important, but the access to good policy, the access to being able to lobby to the very highest echelons of our nation. So, Melissa, if you just pass on that thanks to your organization and to Berno. So, everybody, we've come to the end of our presentation. I don't know if anyone would like to write any last-minute questions, and please feel most welcome to do it. As every single person who's spoken today has indicated, this is a significant problem. And maybe we can be cynical and say, is it ever possible to solve? Well, we will only know that in time. But what we know is each one of us, each one of our organizations can actually make a difference today in multiple ways. And it's about getting hands-on. It's about being in the communities and working with the communities to solve the problem. It's about investment in technology to provide innovation in this space. It's about lobbying local government, local organizations, and of course, at the very top, the national government. This is something that we have to take seriously. We are deeply involved as our organization, and we'd love any of you who want to partner with us to please get in touch. There's so many opportunities and ways for you to get involved, and we would love you to do that. And one way that I would appreciate your support now is just to connect with World Vision South Africa on all of the social media platforms. So we are on Instagram and Facebook and Twitter and YouTube and obviously LinkedIn. We think that the more we connect, the more we allow our message to spread virally and to spread widely. And here's our commitment. If you follow us with your organization, we will follow you right back so that we get the message distributed. I'd love you all to even look myself up on LinkedIn, Bruce Layzell, and let's get this message of sorting out ubiquitous, universal access to water. And in the wonderful words of Dr. Opong, no water, no life. And when we provide water, we are saving lives. So thank you so much for your participation. I don't see any additional questions. Thank you for the people who've contributed through talking and the people who've contributed through the comments on the side. We will be sharing all of this content with you, of course, in due course. And then one last thing, you'll see a QR code. If you want to donate to World Vision or find out more about us, if you just scan that QR code with the phone and the camera on your phone, it will take you to our website where you can find out more. So thank you, everyone. Let's go and make a difference to this beautiful nation. Thank you so much.
Thank you, Bruce.
Pleasure. Thank you, everyone, and we will look to connect again in the future as World Vision runs more and more of these webinars on a variety of impacting subjects that will transition in South Africa. You can feel free to log off.
Thank you, Bruce. Bye.
And I'll end the conference in just 10 seconds. Thank you, everyone. Appreciate your participation. Bye-bye.